Career of a Registered Nurse by Shannon Lopez, which is me. Now, the reason why I wanted to talk about registered nursing was because I am actually applying to the nursing program at the end of my spring term. I am finishing up all my prerequisites by the end of the spring term. So that way I can apply for the program and hopefully get in. So I'm interested to see what the future, has in store for me when it comes to nursing. So I thought this would be a fun way for me to not only educate my peers, but to also educate myself on nursing. Now, some of the nursing duties, daily duties depend on the environment that they're in, such as hospitals, clinics, or in schools. However, there is just some common duties that all registered nurses do in all settings, which is administer medication, consult with other healthcare providers, meaning other nurses or doctors, monitor patients, meaning taking vitals, doing tests, things as such, educate individuals and family on medical conditions and treatment, basically letting the family and the patient know what they have, if they have anything, and the possible treatments that they could take in order to recover from this. They also are responsible for managing medical records. So you see those nurses that are behind the desk in a doctor's office, they tend to handle your records, put them in your file. They also handle billing and things as such. Now, there is some related nursing occupations. When you're becoming an RN, you're just not limited to solely seeking out RN occupations in hospitals. There are just some other occupations that you could feel that are related to nursing, such as social and human service assistants, meaning that you're going to be basically taking care of these children and making sure these children are safe and are healthy, and when Child Protective Services does in-home checks. Emergency medical technicians, which are EMT, so you basically are at the site of the scene of where the patient is at and having trouble, and you make sure that they're stable before they get to the hospital. Physician assistant, which are nurses that you typically see around doctors a lot, that they're kind of shadowing them because they're most likely going to school to get their doctorate in whatever profession the doctor that they're shadowing has. An occupational health and safety specialist. Now, these people are specifically in companies such as hotel settings, so they're nurses that are in businesses that any worker could come to if they have any injury on the spot during their job. Now, the work environment for registered nurses are not limited to these, but these are just some of the basic ones. They're hospitals, physician's office, some healthcare services and nursing care facilities, which are basically old people homes or homes for people with disabilities, or other things such as hospice. Other work in outpatient clinics and schools, meaning basically schools or in businesses that hire these nurses to take care of their workers. But being a registered nurse isn't easy. It comes with some hard physical and emotional conditions you have to endure and overcome at times. Registered nurses spend a lot of time on their feet, walking and standing, checking in on patients, and making sure everything's all right. They also need to be able to handle the stress with the job and cope with direct involvement with human suffering, emergencies, and other on-the-spot pressures such as death. Being a nurse is not easy. You have to work long shifts most of the time, and even on those shifts, you have the possibility of some of your patients that you're caring for dying. As you can see in the top left picture, we have 3 nurses that are crying because their patient just had a miscarriage during labor. And then on the bottom left, we have a nurse taking a break sitting on a patient bed, and this is in New York City during COVID. Now, nursing education steps. Like any degree program you enter, you have certain prerequisites that you have to complete in either high school or college or both in order to begin applying for a career program such as nursing school. For example, here at Lake Sumter, some of the nursing prerequisites that I've had to complete in order to start applying for the program and to have a possibility of getting in is Anatomy and Physiology 1 and 2, Microbiology with lab, Intro to Psychology, and Statistics. Now, nursing, in order to work in a nursing environment, you either have to earn an associate's degree in nursing or a bachelor's degree of science in nursing, which is a BSN, or get a nursing diploma, which is a certificate of nursing, such as licensed practical nurses. Now, the ADN, which is the associate's degree in nursing, takes about 2 years to complete and prepares you for an RN position while allowing you to have a flexible schedule in order to return to school to get your bachelor's in nursing. A 4-year bachelor's degree offers more comprehensive nursing preparation and is basically more detailed than a RN degree. If you already have an associate's in nursing or a nursing diploma that you could get from Lake Tech, then you can enroll in an RN to BSN program, which allows you to get your BSN in 2 years instead of the typical 4. Additionally, a student who has earned a bachelor's in a non-nursing degree field, such as AEMT, may enroll in an accelerated or second degree BSN that allows them to transfer with general education requirements. Now, in order to become a registered nurse, you have to take the NCLEX RN exam and pass, which is given by the National Council of State Boards of Nursing. Now, this exam is a national standardized test that determines your eligibility to receive an RN license. You have 6 hours, not including 2 optional breaks, to take the 4-part exam. The 4 exam areas are as follows. The first area focuses on safe and effective care environment. Basically, looks at the hygiene of things that you should be doing and how to keep infections under control. The second practice area deals with health promotion and maintenance. The third is the psychosocial integrity section, which examines ways to promote and support emotional, mental, and social well-being of patients. And the last section, which makes up the largest part of the exam, assesses physiological integrity. This category examines appropriate nursing care to decrease the risk of complication. Now, the typical pays of RNs vary depending on the state, but since RNs are one of the fastest growing careers in need and are a constant need, combined with all the schooling that goes into one, is why its annual wages is higher than the U.S. median salary, which is $50,000. To be exact, employment of registered nurses is expected to be growing 12% from 2018 to 2028, much faster than the average for all occupations. Employment for RNs will continue to grow because there is an increased emphasis on prevention care for things such as COVID, increasing rates of chronic conditions such as diabetes, obesity, and other things. Nationally, the median annual wage for registered nurses in May 2018 was $73,300. In Florida, the annual wage for RN was $66,938 and $76,420 for a BSN. Now, nurses have benefits. Nurses that are full-time are eligible for comprehensive medical, dental, vision, and prescription insurance, and also malpractice insurance may also be provided. Nurses can also get vacation time based off of each hour they work, and they're also eligible for overtime pay when they worked on scheduled holidays. The average sick time for nurses is about 40 hours per year, and they also have short-term disability, which is often available for an average of up to 26 weeks. Hospitals often pay 100% of tuition reimbursements for registered nurses who seek continued education in a specialized area. Some employers set a predetermined amount for tuition reimbursements. Others reimburse for tuition are based off of basically the sliding scale and upon the grade of the nurse earns. They are also eligible for retirement packages such as 401ks or 403bs. They can determine how much money to deduct from each paycheck, which will be deposited into their retirement funds. Now, the reasons why this career is for me is that I've always excelled in my studies of any science courses. I've always enjoyed science, especially medical science courses, and that has always reflected on my exams and class grades, which is a major determination when considering who gets into the nursing program. on top of my high class grades and GPA. Additionally, I'm already in the process of applying for the nursing program and taking the entrance exam because I only have 3 more prerequisite classes to take and will be done with them in my associate's degree by the end of the spring term, just in time to submit all my paperwork for the nursing program. Lastly, my mom is a healthcare provider and is working in the health department, and my dad has been a paramedic, and we all have CPR/AED certifications on top of other certifications. So the medical field has run in the family, and needless to say, I've been exposed to it firsthand. And additionally, I've also had a strong connection with nurses and my family, considering my grandpa was in and out of the hospital a lot as he got older, and this January he passed away, but always spoke about how comfortable the nurses kept him and how they always checked up on him and went above and beyond the care for him, and that was a big reason for me to become one.